Plastic. So, good afternoon and welcome to our first live of today. And actually, we're in London today, aren't we?
Yeah.
In this rainy day. So, with me is Nurse Bina.
Hello, everyone.
Hello, everyone there that's been with us for a little while knows Bina's with us most days. So, how have you been today?
Great.
Was you still over in awe with the pig fat?
Yeah,
'Cause-
I've not tried to have a sneak peek or anything. I've been waiting to see the results of everyone, so that's exciting.
So that'll be our next live. So
Yeah.
about 2:30, we're going to be going live. So if you were with us yesterday, you would have seen the nurse here inject pine bottle and lemon bottle into the pork belly fat. The reason why, just why did we choose the pork belly? It was all about the size of the fat, wasn't it?
Yeah, it's also very similar to our anatomy, so it just made sense to go with a pork belly fat instead of like a piece of bacon that's such a thin piece of fat on it. So yeah.
Yeah, because lots of people have done that test. You see hundreds of videos,
Yeah.
don't you, of other companies doing it. You know, we thought, what's the point of doing a piece of bacon? I've got more fat on my nose, probably.
Yeah.
So we're looking forward to that. That will be in about the next hour. So that will be 24 hours of the fat lemon bottle and also pine bottle dissolved in the fat. So it'll be interesting to see. But today we are talking about fillers, and it's come at a really good time actually, because today on the news, another clinic, I think up in Leicestershire, has just the managing director and the nurse has been arrested for doing a BBL, and the young girl died, unfortunately. So she died in hospital after having the BBL, the filler put into her bum, and the nurse that did it has been arrested, as the salon owner, which sort of leads us on to, you know, should that type of filler be done? Should that procedure be done? Well, clearly not, because she's died, but we've all done it.
Yeah, I mean, it's not that it's illegal or anything, but like anything else, there's always dangers to things. So, I mean, it's one of them situations where it's just hard to kind of,
Yeah, but unfortunately, a young girl's lost her life, and also the nurse and the owner's probably going to lose their liberty. So yeah, I think overall there's no winners on it. We just had a question come in from Gordon. Are we all doctors and medical staff? Yes, we are. Yeah. Nurse, your history is Great Ormond Street.
Yeah, so I'm a nurse. I was a nurse from Great Ormond Street Hospital, and I've come to the aesthetic side. So, yeah.
Absolutely right. And then the business is also owned by a pharmacist, an osteopath. So yeah, another question. Yes, we were just talking about that. Yeah, I mean, this live isn't about her or whether or not, you know, that person should have been been arrested for manslaughter, but it's about fillers, and we planned to do this live way before that lady was even had a BBL. But it would be amiss of us not to discuss it, because I know people have very different thoughts about it, and you know, I've done a few BBLs in my time. I've never really been 100% happy with the outcome, and you know, we won't be doing it now for sure. So our policy will be we'll pull that from our treatment list. Although, like we've said, it's not illegal.
Yeah.
It's a trained medical practice. It should never be done by anybody other than a nurse or a doctor. I don't know too much about this case, and obviously I don't think we can really talk about it because it's an active case, but whether they were or not there. So we're going to now talk about fillers. bring the mood up a bit. Let's
Yeah.
not talk about death and prison.
Yeah.
So we're going to talk about fillers, and the nurse is going to go through what fillers are on the market. And today, like always, it's all about education. So we're not trying to sell nothing. We're not trying to convince you to do fillers or not to do fillers. We just want to talk about things about the fillers. So we'll explain the different types, and then we're going to get me on the bed, and then she'll use a pencil and show you where different fillers can be used. The reason why we're doing this is because, would you say 90% of the time when people come into a clinic, they haven't got a clue that there's different types of fillers?
No, and I feel like it's so important to know what you're having put into your face. So, and I don't think there's a lot of knowledge out there for people to know what's the different types of fillers, different makes, etc. So, yeah.
Yeah, so they just go, I want my lips done, and have no idea what it is. So that's the reason for this. So it's, as I said, it's not to try and convince people to have their lips or jaws done or whatever. It's all about to educate you so that when you do go to a aesthetics appointment, whether it's with us or with one of our competitors, you know what you are looking for. Okay, yeah, we can talk about that. Yes, we'll talk about the research on cancer in a second. Right, so what type of fillers do we have in the market?
So there's different consistency of filler. So we have deep filler, which is this one. I mean, there's so many brands out there, but in terms of the consistency of fillers, there's deep, there's fine, and then there's sub-Q. So these types of fillers depends on what areas of the face you will put it in. So, for example, sub-Q, which is this filler, is a much thicker consistency of filler. So this gets placed on like places like the cheeks, the jaw, so places where there's bone, as the filler molds or like holds better onto the bone and lasts much longer in areas like that.
So talk about that one then. So effectively, you actually stick that straight onto the bone, don't we?
Yeah. So
how does that feel? Because you've had it done yourself. I've had it done. So
a bit of like, it's not that it's painful, it just feels weird. Like, you know, when you're at a dentist and you can feel like something hitting your teeth, it's kind of like that. But yeah, so because it goes straight into the bone, you feel that little bit of sensation.
We've got a question about what a lip flip is. That's a really good question, isn't it? So it actually isn't filler, is it?
No, lip flip is to do with the muscle. So we inject Botox on top of the muscle on the upper lip, which helps lift the lip really subtly. So yeah.
So effectively, what it is, it's just there under the nose, and then what it will do is it will just turn the lip a bit like that. So if you can look at Bina's lips here, you see how they're full anyway, but a tiny little bit of Botox up there is just going to lift it like that. I really, really love lip flips, don't you?
Yeah, I think they're great, especially for people who are not too keen on filler or don't really want volume or anything, but they just want their upper lip lifted a bit when they smile, as it disappears for some people. So that just kind of, you know, gives that upper lip effect much nicer.
Okay. So as far as jaw is concerned, then, so the sub-Q is used for bone. So we know about jaws and cheeks. When you're looking, so let's say I turned up into clinic and you were looking at me, how would you know how much filler to put into my jaw? How does it work?
So it depends on your face shape. I think face shape's a very important thing. Also, depending on the look you want. So yeah, I think that's two main factors. I don't know if there's anything else you want to add to that. But
yeah, I think so. I think for us, the question that we always get is like how many mils of filler, because of course these are expensive, aren't they? So the average price, I think, is what, £120 a mil for filler, so £120 a box. So of course everyone's interested, you know, is it 1, 2, 3, 4, 5 mils of filler? I think it's really impossible to tell until you get going. And what I like to do is I like to do one side. So effectively, you know, if I was doing Bina's here, I would do the one side of the jaw, let it settle, and then show her and say, right, what do we think? And I think until you get going, it's really tough to know.
Yeah, I think, same thing I was saying, like in terms of what the client likes. So it's important to show them. If they want more, they want more, but you know.
So that's
just having that conversation.
So that's sub-Q. That's the name of the filler. It's not the brand, it's the type of filler. Moving on to deep.
Yeah, so deep is a bit finer than sub-Q. So this is used for places like the lip. You can also use this for very deep nasal fold lines. But yeah, so that's what we use deep for.
And that's going to be a thicker consistency, isn't it? So effectively, when we look at the nasal fold, so again, if we look at her nasal fold here, we've actually treated her with PRP.
Yeah.
So it's a slightly different one. But if you imagine that laughter line, now often people don't realise that laughter line comes from smiling. So if you smile for us, there you go. You see how she smiles? So it's this line that goes down. But also sometimes people get confused with this line, don't they? Which goes down from the corner of the mouth, which is what it's all about. So how does... so we can fill both areas, can't we? The laughter lines and these and the Marilette lines.
Yeah.
And when we're doing lips, we were talking to another patient just recently. We have a little secret weapon, which is where we inject a little bit of filler in the corner of the lip. So I don't know if anyone's suffering where it looks like they're a bit sad all the time, or they've got that downward smile. Then that's one way that we can sort of increase that area, which is a popular one, isn't it? What about under here? Deep here as well?
Yeah, so some people get like pebbly chins, or like as you age, you start getting some deep lines on the chin. So we do use filler to just smooth that out.
Okay, so deep is the second sort of heavy consistency as you're talking about, and then we've got fine, haven't we?
We have fine. So fine filler is much thinner than deep, so it's a much of a smoother, thinner consistency of filler. This can be used in areas with fine lines, so anywhere where you might have fine lines in the face. Also for people who are starting lips off, we can use fine to start off and see how you feel with your lips. If you want a very subtle, just a very subtle look of your lips, we can use fine filler.
And that's a really good point, isn't it? Because I bet you there are a ton of people watching that have never had their lips done and are nervous that they're going to come out with these sort of horrific duck big lips. So you tend to always use fine first, do you?
Well, it depends on what the patient wants. If the patient's very wary and wants the most subtlest look of just a bit of plumpness on their lips, I would advise them to have fine. Fine also doesn't last as long as deep, obviously, because the consistency is much thinner. So for someone like that, that would be the best option.
Indeed. And then you could incorporate that with lip flip.
Yeah.
Couldn't you? So that's always a good thing. Go back to what that other person said. So Flower Girl, hello. You've asked how long does filler last?
So it depends. All fillers are different. So obviously sub-Q is the thickest type of filler. So for jewels and cheeks, it lasts about 2 years, I'd say. Depends on your metabolism as well. Some people break down filler much faster than others. For the deep filler, it lasts about 9 months to 12 months, also depending on your body. And then fine, I'd say anywhere from 6 months.
6 months, yeah, 6 to 8 months. And I think it also depends on whether or not you smoke. That affects the lips for sure. Vaping will affect the lips, won't it? And also the amount of water you drink, because all of these fillers are made of hydrochloric acid, and what will happen is they will attract water, so they will grow. We've had got a couple of great questions. One from Debbie that says, "What sort of price is a lip flip, please?" So we'll answer that in a second. But sorry, Jay said, how to prevent the migration type of look. So if Bina turns to the side, what you're talking about is where this is much bigger like that, so you get that look of the duck. It's all about the placement of the filler. So typically we tend to keep away from the top border when we're doing this, so that you don't get that look, that duck look that you're looking for. Also, migration happens when they pierce the edge of the lip, which the borderline.
Also, I think one thing that's not discussed a lot is the shape of the lip originally. I think if someone has very small skin on their lip, like a very thin top lip to begin with, it makes no sense to inject so much filler in there because that's just gonna start filling the top outside the border of the lip. So it's very important to look at the patient's lips, the size of the lips to start with, how much skin they have, and then
Absolutely right. And I think if you look at Bina's lip, so I did hers about a year ago, and I think what's important, you see that the shape is inside the lip, so there's nothing here. And I think it's these bits here that causes the look that we're talking about, isn't it? So, and often women will end up with a lot of filler at the top of this lip and think that they've got to dissolve the whole lip, but of course you don't have to do that, do you? So how do we deal with that?
So we'll just try avoid the lip itself, try dissolve on top of the upper lip, so wherever the migration is, it's you can do that.
Get rid of it. And in fact, we've had people who've come after that and gone, my God, it's like we've got new lips. And in fact, it's exactly like that, isn't it? So I had one particular client and her lips looked really big, but she wasn't happy with them. And I think the problem was that she wasn't happy because it was this bit here that was really big. So when we dissolved it, it just naturally showed her lips off. And that was a lovely one. That was a lovely one. That was a lovely example of it. Right, what other question was that? The price of a lip flip? Yeah, well, it will depend salon to salon. We're £80, I think, are we? Should be able to check that. I think we're £80 for a lip flip. So not dear at all. Certainly cheaper than having filler. Because filler typically, again, some salons will charge you different prices for different areas. I really don't like that. Do you like that? No. I find it really frustrating. So what we do, we just charge you for the filler. So effectively, we'll just charge you the price of the filler, and then whether we stick it in your lips, your jaw, your cheeks, regardless of where we put it, we charge you the same. But some salons, and you need to be really careful of that, is they might charge £200-300 for lips, and then they'll charge you £200 for this or £100 for that. So it's not really good. Not really good. So another good question, is it imported from Turkey? Absolutely not. The world's 90% of the world's filler comes from South Korea. Now we can talk about that quickly, can't we? So South Korea are about 20 years ahead of anybody when it comes to anything to do with the face. So whether that's the skincare range, anything like that, South Korea are just miles ahead. So we have an arrangement with some South Korean doctors and factories, and we bring our products straight in from South Korea. They all are CE marked though, so this is the other important thing. So if you look at the box here, it's got CE on it. If it hasn't got CE, then it means that it's probably from Turkey or from some other place. Whereas this, although we've bought it from South Korea, it's got that European mark of seal, and that's really important. I mean, we heard about that lady that was putting cement. I don't know if you were here then. Yeah, there was a lady putting cement and other God knows what into people's faces, and I think that's one of the reasons why we wanted to do this live, because you know, when people turn up into our clinic, what we do is we show them the boxes. We'll open the boxes in front of them, and I think things like this is really important.
Yeah, I mean, even in the syringe, it's important to know if you're having fine filler, if you're having, because imagine someone does inject subcute into your lips or something like that. It's like very dangerous. So it's important to know what you're having, what type of filler you're having.
So one of the things that we oil, I've heard that too, Eve. So one of the things that we say to everybody is, if somebody rocks up with a syringe, whether it's Botox or filler, I would refuse it. Would you? Mm-hmm. I'd insist on seeing the box opened. Yeah. And I don't just mean the box open, but I mean I'd want to make sure that this is new. So when the box is opened, You see how this works? You can see that it's completely new. And this is really important. Also, I'd want to know that the date is correct. So on all of these fillers, they've got a date when it was made, and a date when it was shipped, and a date when it's out of date. So you want to be checking all these, don't you think?
That's very important, yeah.
Because otherwise, you just don't know whether this is some old filler that's been hanging around.
It might not even work.
It might not even work, yeah, absolutely. We just had some questions come in. Debbie says she finds these live so interesting. And you're 66. Thanks, Debbie. Yeah, I mean, we when we started this about a year ago, we were determined to make this an informative type conversation. So whenever we do anything, we're trying to share what goes on and how things work in the clinic. We obviously want you to come to our clinic, and we're in West London and also in Brentwood. But obviously, if you don't, we'll give you the knowledge so that when you do go to a clinic, you're totally safe. And that's our main goal. So we're not slagging anyone off. We're not trying to say that we're better than anybody else. What we're trying to say is that let's give you the knowledge that you need so that when you come to us, you can challenge us. And if you go somewhere else, you can challenge them. Yeah. Would you say that's important?
Yeah, that's very important.
The same thing when it goes to Botox. You know, I have heard people that don't see the Botox being taken out, and it might not be real Botox. It might be watered down. You want to see them taking it out. And also when they take it out of the Botox bottle in front of you, if they use the same needle, you need to get off that bed and run.
Yeah.
Why is that?
So dangerous, double dipping, anything like that is, yeah. So
the good practice should be that there should be three. If you're having 3 places, you should have 3 needles. If you see that technician put that needle back into the bottle, then he's done it before with someone else. And any bits of blood,
risk of infection can be so high with things like that. So yeah, it's really dangerous. I mean,
yeah. So it needs to be done in front of you. As far as Scotland's concerned, Flower Girl, no. If you send us a message, though, we'll try and find you a decent clinic in Scotland. However, we have people from Scotland come all the time into central London. I mean, the one girl that came to see us 2 weeks ago paid £76 for a flight, so it weren't dear. Does filler migrate, nurse?
Yes, of course it does. We just had this conversation about how the technique and how it's placed can have an effect, or the shape of your lips. So there's loads of factors that can go into like the migration process of filler.
Sorry, someone just said thank you for not answering my question. I haven't seen your question. Let me have a look. All right, yes, I did ignore that question. I'll tell you why I ignored the question. It's because you should be able to tell that we are fully qualified and registered. I mean, Lord, would we be sitting here in nurses' outfits if we weren't? But yes, to answer your question, sorry, maybe I was rude, but I just was hoping it would be obvious the way we're talking. Of course we are. Of course we are. So, Nadia, yeah, if you're in Croydon, you can come to us. We're in Tottenham Court Road. So, does the Elizabeth line go to Croydon? No, it's Abbey Wood.
Sure, but you probably have to swap over or something
like
that.
No. Come to us in Central London.
I don't think it's too far from here to Croydon.
No, not at all. Not at all. If you ask nicely, one of the nurses would come to you probably. Right. What other questions have we got? Won't everyone end up looking like Nicole Kidman? Well, do you know what? I'm gonna answer that question because I agree with what you're saying, that sometimes we end up seeing the same look. You know, sometimes when you might see a picture from a bunch of girls in Dubai and they all look the same. With us, one of the things that we try and do is not do that standard look, you know, where someone's got everything pushed back. And I think the universe, we attract what we want, I think, because I don't think we've got over 2,000 patients, and I can't think of one with big lips.
And I think it's important to go with the client's face, their face shape, not try to achieve that look where everyone does look the same. So we really go by what that client wants, and also depending on their face shape and features.
Do you know what? What you just said is so good, and none of this is scripted, by the way. And I was just thinking about that girl that you did where she didn't have a cupid's bone, and you just followed the lip round, and that was her look. You didn't try and make a cupid's bone.
I think that's where it can go wrong, when you try to do something that is just not. It's just not what the face kind of goes with. I don't know if that makes sense, but
I think it does, and I think that's what we say, and this might sound really awful, and I say it with a bit of a caution, but typically the people that look all the same look like that themselves, and I'm not sure if that's politically correct, but we'll perhaps move on. Other questions that came in. What do we do? Well, I think we do. I think you know what we do now. So are you nurses? Does that make you better than doctors? And the ladies that do the practicing and the men that do the practicing on the beds are nurses. We train nurses and doctors to do this job. Now, again, I've got to be a little bit politically correct. We've had, in the 5 years that we've been doing training, we've had 2 doctors that have failed to finish the course. Now, why that is, I don't know. I think a doctor knows a little bit about everything, whereas a nurse, no, I'll let you ask. How different is it between a nurse and a doctor? Because you learn so much about everything, don't you?
Yeah, I think as nurses, we have the interpersonal skills as well. So I think patient interaction, knowing your patient, it's very important. I'm not saying that doctors don't, but I think that does play a big aspect. And I don't think it's always about how much the person medically knows, because when it comes to aesthetics, it's very different. So, yeah.
And we have a ton of doctors on our book that come and have their work done. But, all I can talk about is my experience. What's your name? Bushra? Is it Bushra? All I can do is talk about my experience. And we had some really educated doctors, doctors practicing GP that came and never finished the course. Our courses are 12 weeks. So Bina here as a nurse, she's super qualified. She was a theatre nurse in Great Ormond Street, but she still maintained a 12-week course. She didn't touch a real live patient until probably week 4, and everything she did was under supervision, and she's super qualified. And maybe that's why the doctors failed, because they just didn't like that, being told what to do. Maybe, I don't know, who knows, but I think hopefully I've answered that question. So yeah, thank you. Is it Nashkar? Answer the question saying that it doesn't matter if you're doctors or nurses, you still need to be trained in aesthetics. So yeah, that's exactly what we've just spoke about. So for us, we do this 12-week course, and it's tough. Well, how tough was it?
Yeah, it's completely different. Obviously, some skills are very similar to what you would do as a doctor and a nurse, but it is a very whole different industry. So yeah, whether you're a doctor or a nurse, you still have to train and do something completely different. So
yeah, indeed. Right, what else are we now? I've got all 3 and look natural. Absolutely good, Hayley. Hang on, where are we? Have you got any jobs done on yourself as a doctor? So yeah, me, I've got a ton of work on my face, I'm afraid. So starting from the top of my head, I have PRP for hair loss. So the girls have been doing that for me. I've got Botox on my forehead. I've had my nose with a little bit of filler. I've got filler on my cheeks and my jaw. What else have I had? I've had my neck done. So I've had some fat dissolving done under here. Is that it? I think so, yeah. The only thing I haven't done is my lips. Dental nurses, no, dental nurses
I think
are
that's
very
where
different.
it gets confusing.
Go on, talk about that.
Dental nurses don't have pins, they're not registered. They have the name nurses, but anyone can really be a dental nurse. It's just a course that you would have to take, but it's not a qualified registered nurse.
So Colleen said that she came to our clinic and she wanted PRP to help with my jowls, and we were honest and told it wouldn't work. Thanks for that, Colleen. I'm not sure who you saw, but you are 100% right. We'll never do anything that won't work.
Yeah.
If we do try something that may not work, we'll always put a caveat on that, don't we? So we'll say, look, we're not sure if it will work. One of the things that we also do is, if anything new is out, we always do it on each other first, don't we, as well? So that's another, I think, an important point on that. Everyone does the same course. I found a non-medic was much better than a nurse. So that's from Tony. I think Bina sort of answered that about it doesn't matter what you are, a nurse or a doctor, everyone has to go through training. As far as the training course is the same, it isn't. There are 2-day training courses out there that will sign you off as a Botox expert after 2 days. That ain't the same as a 12-week course, is it? Our non-medical courses are a week long, and that gets them to level 2, I think. All nurses go to level 5 aesthetics. Oh, thank you, Samantha. I'm not sure who you're talking about, my face or her face, but we'll take it. Yeah, Bushra, I think we've covered that with the doctor's skills. Where are we? Can you see? Had threads. Colin spoke about threads. You're right. I mean, if you've got that real overlapping of skin here, then it's just not going to work. You need to pull up like that. So you can see how, if I pull her skin, how tighter that gets. And that's exactly what threads will do. Are they taught? Yeah, the nurse I trained with said injecting her face is completely different to anything else. They're taught. Would you agree with that? Yeah. I think Bina's already agreed with that, to be honest. Right. Where are we going? Thank you, Samantha. What do you use on your skin? Just Botox for flawless glow. Are you talking, sorry, is that AGS? Are you talking about Bina or me? I can sort of answer that question for both of us, actually. We both use Eve Taylor, which is a brand of toner, cleanser and moisturizer that we both use. And I think that has a lot to do with our glow, doesn't it?
It's a very gentle brand, and it's a very they have incorporate natural products in the brand, so it's really good.
So now, thank you. So I've just answered it for you then. What do you reckon for somebody where they're in their early 30s? So Bina's late 20s, mid-20s, mid-20s. We have a lot of people that come that have had absolutely nothing at all. And often what we talk about is what bothers you the most. So, for example, I'm sure Bina won't mind me talking about it. She's a beautiful girl. We know she's beautiful, but she has an issue that none of you can see. And I'm not even going to tell you what that issue is, but I know there's an insecurity here that she has, which we've dealt with over the last few days, but you can't see it. And I think that's what our job is all about, is to understand what you're worried about and then to try and fix that, so that what I did to Bina 2 days ago hasn't changed her face, hasn't changed the way she looks, but it's dealt with her insecurity. And I think that's what I'd suggest to you, that when it comes to someone in their early 30s, it's all about what worries you. So it might be that you feel like you don't like the fact that you're unsymmetrical. That's one thing. It might be that one eyebrow is slightly bigger than the other. It might be hooded eyes. It might be just a little bit of sagging skin. I don't know. If anyone answered that question by saying you need Botox fillers and you need fat dissolving, then they're just trying to sell you something.
I don't think it's right to say you need this. It's more about what do you want to achieve, or what is your insecurity, or what's worrying you.
Yeah.
So it's more about that.
And for me, when it happened to me, my biggest issue was up until I had filler on my jaw, I used to look like a ball. So when I put a cap on holiday, I looked like a football with a cap on. I used to hate it. If you look at some old pictures of me on social media, I had a really round face. So for me, it was all about my jaw. Okay, our clinic's called 65 Beauty. All of our details are in the bio. So Jen said, can you tell me about nose slimming fillers? Good one, Jen. So when it comes to the nose, Bina's had absolutely nothing done on her nose. I have, but Bina didn't do it. So when it comes to the nose, there's lots of things we can do. We can deal with this area here if you've got an issue. We can slim the nose with Botox if you have an issue. We can deal with the tip of the nose and turn it up. I think that's called pixie nose. So when it comes to the nose, we either use filler if we want to try and create any sort of straightness or get rid of anything. Typically, if it's been broken, here is a classic one where you might have a bump and we just want to fill that in. The pixie nose, all the slimming of the nose is actually Botox, Jen, is what we would use about that. We are based in central London. What's her name? Called? Cooked. Did your parents not name you correctly, Cooked? So her name's Cooked. I feel cooked after my holiday. We're in central London and also we are in Brentwood. How often do you need PRP? So, depends on what you're talking about. PRP on the face, two sessions should do you for about 2 years. Whereas if you're talking about PRP for fillers, like on the jaw, about 5 years. Depends on what you're talking about. So Cooked has also asked about hooded eyes and Botox. Do you want to take that one?
Yeah, I mean, Botox can help lift the eyes, so it can help with just giving you a nice eye lift, but it doesn't help with sagging of the. So if you do have extra sagging of skin on top of your eyelids, the best thing for that would be something like thread that just pulls the skin up from the eyebrows. So yeah, in a way it does, but not too much. It just helps more with opening the eye up.
Yeah. So I've had both Cooked. So I've had both Cooked. That's really weird, isn't it? So I've had Botox. So I had really terribly hooded eyes. So I've tried the Botox. The girls did the threads on me just recently, and that worked superbly. I can't believe how I can see better.
Yeah, it's opened up his eyes really well.
Yeah, unbelievable. I didn't realise how bad it was. So Tony said, I disagree, no different from a nurse to a non. Only blood checks differ, but love watching us. I'm not sure I understand that, so we'll do that. Not a candidate for Botox with the eyes. I'm not sure I understand that either. I have a word with my mom about my name is not yet. So well done. That's a really good one. How much is threads for hooded eyes? They're $250.
Yeah.
I think at the moment, or they're
$350. No,
$350 at the moment for hooded eyes. But I tell you what, it's money well spent. If you go and look at our timeline, I think my before and afters on there, isn't it?
I think so.
I cannot believe. Oh look, there you go, 300. We were almost right. Both of us were almost right. That just proves that we're not selling, I think. Oh, I see what you're saying, Tony. Sorry. Yeah. So the frontalis, for those who don't understand the words that she's talking about there, so the frontalis is this muscle that runs from the corner of the eyebrow to here, and it comes up, and then you've got a little gap here, and then the frontalis also goes behind the head. I don't know if people will understand that. So when we're treating migraines, we'll inject at the back, whereas the corrugator is this bit here,
which is the glabella muscle.
The glabella muscle as well. So that will be that. And you're right, that's what we're treating. But we were trying to keep it non-medical, Tony. So just to try and make it nice in English. How long does thread last? So
So yeah, 2 years. The threads dissolve within 6 months. But what happens is from the trauma of the threads, once they are dissolved, your skin starts to produce collagen, which helps with that lifting effect
And what
to
about the
last
not
longer.
recommend? How long? The positive bit. I think that's
Usually
down to who's done
recommend
it.
them, as I haven't really heard positive. Yeah, I do recommend them. I think there's a lot of bad clash about threads, but I do think it's important to know how it's done and what you're having done, and all about the procedure
And who's
before.
doing it? Let's be
Yeah, and
honest.
about who's doing it, and yeah. So yeah, I do think it's good.
I was really skeptical. I've got to be honest. I've been doing this job a long time, and I've run this clinic for a long time, and I was very, very skeptical about threads. But with people like Nurse Bina, who is ex-theatre, she's been using sutras, all of her nursing life, and the barbaric look of it, because I think that's what puts people off, isn't
Yeah,
it? It's that pulling
yeah,
and pulling and
yeah.
pulling. As long as you are understanding the anatomy, like these girls are, these nurses are, then it's all about the pulling properly. And yeah, I've had no problems, so I love it. I've got to be honest. I'm a converted lover. How much does fillers cost? So it depends on the clinics that you go to. So I don't know if you saw all of this live. What's your name? Nazai Raja, I think. I need to go to the doctors for my new glasses. Never mind bloody eye threads. What was the question? How much does filler cost?
How
Right.
much does filler
So
cost?
it depends on where you go. And for us, for example, we have often really good offers on. So at the moment, you can buy one, get one free on fillers, which I think is pretty cool.
Yeah.
So for us, it's £160 for a mil of filler, but in fact you get two, so it's working out £80, £80 a mil. Some clinics will treat you depending on what area, so they might treat you £300 or £400 for Russian lips. We don't do that. We don't do that.
And that filler doesn't have to be used in the same place. It can be used in different areas. So say you wanted your lips, and you get an extra one for free. You can do your cheeks or your jaw.
So Jo has said she's had threads in her cheek a year ago, but still no different. So why would that be, do we think?
I think sometimes it's about expectations as well. I think it depends on how much of a drastic look you thought it was gonna do. I think a lot of people do think it's that really drastic facelift, that surgery, but it's not. It's more of a. It does lift, but it's more subtle than that. That very
Or could it
pulled
be that
back.
she didn't have enough and it's dropped?
Is that also so sometimes where there's not enough threads placed, it doesn't support the cheek enough to pull back, because it could be more skin there that's heavy to pull back on, so that could also be a case. So I mean, there's a lot of factors that can go into why that didn't give the look you wanted. Yeah.
I think what would be interesting, I don't know where you live, Jo, but I mean, if you are London or Brentwood, you can get to us, then come and have a consultation with us, because we'll give you an honest opinion. Or if you want to send us a before and after picture, and if you know how many threads were used,
Yeah.
we'd give you an opinion. So if you want to message us, that all of our details are in the bio. We will gladly give you an honest answer. How do you prevent the dreaded thread drop? And that's come from Joanne Cole. I'm not sure I know what that is. Is that
How do you
when?
prevent? Oh, that can be to do with facial expression. So what's really important is, once you do have threads, to not try and move your face as much for that good 24 to 48 hours, as that can ruin that lift initially. So I say that can probably be what you're talking
Or does she
about.
mean when the threads dissolve and the collagen's taken over?
I'm not too sure. Maybe if
Maybe if you could just expand on
yeah.
that, Joanna, will answer your question. I mean, if it is that drop when the thread has dissolved, well, we guarantee ours for 2 years, so we would put them back in. Simple as that, I think. But I don't know. It might not be as simple as that. Pain relief for threads, Debbie's asked. So we do local anaesthetic. Do you
Yeah,
want to talk
so
that
we
through?
use lidocaine, we inject lidocaine as well. So it's not just a topical one, we inject as well. So that helps make the procedure very painless. So yeah, we do.
I had no pain. It was just it was the pressure. That's what I remember. It was the pressure.
Every patient that has had it done so far with us, they say that it's not painful at all. It's just the pressure. It's uncomfortable from the tugging, but no pain. They don't feel no pain with it.
But I want to go back to what Joe said, and also what Joanne said about the dreaded drop, or not getting the look you want. I think the biggest problem in this industry is also the biggest problem in our country, that we often are not happy with what we've had done, or what we've had served, or what we've eaten, or whatever, and we don't say nothing, and then we just then slag off either the procedure, or the food, or the restaurant, or the hairdresser, or whatever it may be, without actually going back and telling the people that you're not happy. One of the things that we have in our clinic, which shouldn't be unique, is we have literally we have a no question guarantee. So let's say we do your Botox today, and in 8 weeks you've still got movement, just come back. And if we have to do the Botox the third time, we will. If we do your cheeks and you're not happy, then come back. And it might be as simple as just adding another thread in, might it?
Most of the time it's very fixable, and it's something that we can help you with to get. There's no point going away and not feeling happy about what you have done. It's more important that you come back and we can help you with it, and then you get what you want at the end.
Especially the money you pay,
and make it worth what you've paid for.
Some of these thread lifts can cost £1,500–1,600. So if you're not happy with it, you need to come back. And that's not just for our clinic. I'm sure the majority of practitioners out there will say the same thing. That if only you told us, we would have put that extra bit of Botox in, or we would have put that extra thread in, or even given you some more filler. I mean, we had a client who wanted a really specific look. So what she was looking for, can I borrow you again? Yeah. What she was looking for, she wanted absolutely no filling here. She wanted it all filled here. So this was, I can't even do it without hurting her. Pull back. So I put the filler in. I think we put in 2 mil or 3 mil or something like that. And she came back and said, no, it's not quite right. So we put more in, and she paid for that. And then we got to the stage where she went, yeah, that's fine. And then she come back, didn't she? And said, no, it was that particular look.
She came back 3-4 times because she had a very particular look that she wanted. So then at the end, when it was all done, she couldn't be happier. So
yeah, and we charged her for some of those comebacks because it wasn't our issue. It was just because she wasn't describing it well. But once we understood exactly what she wanted, I think she came back one more time, and we didn't charge her for that extra filler. And she was delighted because I think her husband had just lost his job or something. And she was like, oh my God, my husband's going to kill me because I'm spending more money. But it ain't about money at that stage. It was about just making sure she was happy. Right, as far as lip filler courses are concerned, we do those. So if you want more help, what you can do is you can come and buy either half a day or a full day with the nurses, and they will train you 1-to-1 or 2-to-1 or whatever you want. So what's your name? User 6654, or was that Yusha 4654? User 654. Come and see us. Come and talk to us. And message Emma, and we'll talk to you. Joanne Cole said she's a practitioner and looking for help with optimizing your cog thread results. Again, same thing. I don't think you need to go on a training course. What you should do is just come and buy some time. Like when you buy time from a plumber, he'll charge you £100 an hour or whatever it may be. Well, we do a very sort of similar thing. So you can come and have some help, and you can buy the time that you want, which works really well, doesn't it? So you'll work with one of the nurses, and then we will obviously help you with your training. Random question from, what's that lady's name? Garden or something, isn't it?
Pamela Gardiner.
You need to do the reading out because I'm really struggling here.
Does the post-thread collagen get stimulated as much as postmenopausal?
That's a really good question. Yes. So as an older person, the threads, the menopause is going to affect the collagen, isn't it?
I mean, as you do get older, it's harder for your body to produce collagen. So that just might mean that it doesn't last as long for you. Your body will still produce collagen from the trauma that the threads has caused, but it might just be a quicker for it to go down. So,
and it might be that we might need to do a bit of filler as well as maybe the threads, possibly,
maybe, yeah.
or maybe get her on a drip for collagen.
Mhm.
Maybe, I don't know. There might be some other options. Who knows? Right. I missed your question. So, what was your what's her name again?
Oh, we just answered that one.
I think we just
Pamela,
answered
yeah.
it, but if we haven't answered it, then ask it again, and we'll definitely ask it. So Joanne Cole says she'd love to come and visit you. How can I get in touch? Oh, we just did it. Right. Sorry. We my eyesight is crap, and secondly, there's so many coming in. Joanne, yeah. So to get in touch with us, there's a link tree on our bio where you can contact us or just send us a message. Michelle says she wishes we were in our area. I would definitely come to your clinic. Where are you, Michelle? Because to be honest, what we're discovering now is that where we're doing these lives, people are coming from all over the place. In fact, Sweden is.
Yeah,
We've had
we
a
had
girl,
one from
a
Sweden.
girl fly from Sweden, and I think Aberdeen. So that might be a bit of a stretch, Michelle. But you know what? It's one of these things that maybe a flight down to London, if you book it, say 3 months ahead, things like that work really well. It's really lucky because we're in Tottenham Court Road, which is the Elizabeth line. So actually, when you get to Heathrow, it's £12 tube straight to us, and it's about half an hour from Heathrow, isn't it? So I think that's why we've been getting them in. Go on.
Yeah, if I book a consultation, would you be able to do treatments the same day? Yes, we can. If you just let us know what the consultation will be about, then we can try fit time for that. So yes, we can.
So somehow we've gone from talking about filler to talking about loads of other stuff, and that's what I really love about these lives. But let's go back to the filler. You got your pencil. So what we're going to do now, we're going to go back to our filler and talk about the sub-Q and talk about the things. And yes, there is in Brentwood. So in London, there are some stairs that you need to deal with in London. But in Brentwood, which is on the Elizabeth line as well, then there is wheelchair access. Depends on where you are. We do come to people with disabilities. So one of the nurses can come to you. We might just need to change the time we do it. Hi, Jacob. We're talking about fillers. Well, we were talking about fillers, and then we've digressed to everything from are doctors any good? Oh, well, if you're coming from Ashford in Kent, then you could get to Brentwood for sure. Yes, Tony, we covered that at the very beginning of the live. Let's cover it again. So, for those who don't know, a young girl died just recently from having filler in her bum. It's called the Brazilian uplift, or the BBL. It's a practice that we have done a number of times. It's a practice that we teach level 5. So I don't know if you know much about the levels, but you have intermediary or you have basic Botox training, which are these 2-day courses, and then it goes right up to level 7, where you are practically advanced in every technique. We teach all of our ladies, all of our men and ladies, up to level 5. So that's where people like Bina is. Some of the nurses then go on to do level 7. Bina's one of them. She'll be level 7 by the end of the year. So anybody that comes into our academy, we were teaching BBLs at level 5, 6, and 7. Are we going to be doing it anymore? No, clearly not. So for those who have missed it, the nurse and the person who owned the clinic were arrested yesterday and charged with manslaughter. They didn't do anything wrong. No, can I say that? Can't really say that, can I? in the eyes of the law, they've done something wrong because they've obviously taken the life of this poor girl. But I don't think they did it on purpose. Otherwise, it would have been murder. It's a insurable treatment, so the insurance covers BBLs, and there's filler made for BBLs. It's imported. It's got a CE mark. It's got an FDA mark for America. So, but we won't be doing it anymore.
I just think it's one of them things where everything has side effects, everything has dangers, but in this case, it did just go horribly wrong for that person, and
Yeah, absolutely, and yeah, you're right. What's his name? SB Sibs. You're right. There might have been an underlying health condition with that lady. We just will never know. I'll give you another example, though. A nurse came in to clinic yesterday and showed us a photo of a lady's stomach where the aesthetics agent, the aesthetics company, had bought off AliExpress a liposuction. And then actually, so they paid about 900 quid for this liposuction, then performed liposuction in an aesthetics clinic. Now, they should go to jail.
Yeah, that was horrible because the lady is in intensive care at the moment and she's very badly bruised, and it's, to buy equipment from AliExpress.
Do you know what? I just find it mental because we spend tens of thousands of pounds on the equipment that we have here. And the other day we had a board meeting about our centrifuge because I think one of the wives of one of the directors had seen it on AliExpress for £8.50 or something, and we paid, I think it's £3,000 for our centrifuge. Now, the argument would say a centrifuge is a centrifuge, it spins it round. But when it comes to things like the scanners that we've got and the radio frequency machines we've got, then yeah, I should go to jail if we buy it on AliExpress. Right, so let's have some other questions and some other things. So that Sebs has said maybe it wasn't their fault. That's what I just said, I think. We just don't know what's gone on. And it's just shocking when we see things like that. And I think, none of us have got a time machine. So all we can do is decide what we're going to do going forward. And as far as 65 Beauty and 65 Medical is concerned, BBLs are now off the menu, off the treatment list, and off the training plan. Now, the last time this happened was fillers, tear trough.
Yeah.
So this is not the first time shit like this has happened. So for years, we were doing filler under the eyes, and we were doing it as regular as we were doing lips. I mean, this was before your time. I was never really happy with the look I got with tear troughs because it would be always hit and miss whether it would work. And then we saw a report from an Australian doctor where it had migrated behind the orbital and basically ate away at this lady's optical nerves, and she's blind. So we don't do it from that day, and lots and lots of aesthetics clinics followed suit. But I can tell you now, in central London where I am, there are clinics a stone throw away still doing tear trough fillers. Now, I think that's mad, and that's as mad as me doing a BBL this afternoon. What do you think?
Yeah, I agree. There's a lot of even like doctors, surgeons who have aesthetic clinics who are still performing this procedure. So yeah, it's just one of them things.
Yeah, absolutely. That was quite a good question. Someone said, that Shizavain said, I feel that some people don't do their research. Well, that's why we do these lives. So if you've missed the start of this live, that's what exactly we were talking about. So we do these lives not to try and sell these treatments to you. It's to give you information so that you're able to either come to our clinic better informed or go to somebody else's clinic better informed. That's why we do it. So yeah, absolutely. They would be crazy. This is why everyone should go to professionals. Yeah, but I mean, they were professionals.
Yeah, I mean, it's not always down to the professional. It's not always their fault. Sometimes things do go wrong. There's always side effects. There's always dangers to things. So it is sometimes that rare case where something does drastically go wrong for someone. So it is not always the practitioner's fault. And I think loads of people also, there's that misconception with it being the practitioner's fault.
Yeah, absolutely. And I think Shaz said the same thing, doesn't it? It's always down to them. Okay, Bliss. Hi, Bliss. How are you? I would never go to an injector that still does liquid BBL or T. Yeah, there you go. Yeah, so that's exactly right. I mean, it's exactly what we were just saying. So we probably did, I don't know, 1 or 2 BBLs a year if you were lucky. It was few and far between. We would only do it if it was from weight loss. So I think there's a couple of important things here. So we never did it because somebody wanted this big round bum. We would always do it because it would be the sides. So here, this type of area here that we'd fill. So we were never caught up in the emotion of the big bums. This is all before your time. In fact, we've only done one since you've been here, I think. Yeah, only done one since you've been here. So it's a no loss for us. Right, Tony said, yeah, me too. But as far as tear troughs are concerned, Bliss, there are a ton. A ton in Harley Street still doing it. Right, what's that one say?
Alara said they are still giving out the courses for that. Fluids not allowed in aesthetics. Why?
Well, I think we've just covered that. It's because it's not illegal, and at level 5, 6, and 7, you should be doing it, or you should be able to do it. I think your question, the better question is, why are people that have done a 2-day course on Botox and fillers doing it?
Yeah.
That's the better question. What's her name?
Alara.
That's the better question, Alara. That it would be, why are they doing it? It's scary. Just because you know how to fill cheeks doesn't mean you can fill a bum. Or not just bums, but inside. You know what? I've seen cases where people have come to me with inside legs. Now, I don't know if I'm going to get cut off for telling this story, but I do want to tell it because I think it's also very important. I was in clinic about 6 months ago, and there was me and another nurse working that day, and we had a waiting room full of people, and there was a lot of commotion going on upstairs. And I said to my patient, just hang on a second, I need to see what's going on upstairs. So I ran upstairs, and there was 2 young girls, and these girls were about 21 and probably 18 or 19 and early 20s. And what happened, one of the girls had seen that you can, how do I say this without getting cut off? You can put filler into the ladies' private areas. So you can fill the genitals, that's the word we're looking for. So you can fill either side of the genital on a lady's vagina. And she got her mate to do it. So her mate had took this filler, had put it into her friend's vagina, and it's gone wrong. So they were screaming and shouting upstairs, asking for urgent help. So I went upstairs, brought the girl down, asked my patient to wait, and I dissolved it. Now, I've got a video of this, which I wish I could share, but because it was caught on CCTV. So she's screaming and shouting at me as I'm dissolving it, and they were centimeters away from certain places that you wouldn't want to lose sensation in. And I got rid of all the filler. It took about 45 minutes, I think. And you know what she said? She sat at a bed and she said, "Can you put it back in now?" And I went, "What?" She said, "Can you put it back in?" And I said, "No, I can't." She went, "Why?" I said, "Because," I said, "Well, I'm still..." Can you hear us now? Is that better? hopefully you heard what I just said.
Let me see what thing.
Did you hear what I just said?
Oh yeah, now she can hear.
Yeah, we can hear. Perfect. So yeah, so that's what happened, and you know, I was.
Oh, they missed it.
Oh, you missed it. You missed what I said. Oh, okay. Not the last bit. Oh, okay. So her friend had filled her genitals, and part of where she'd filled, she was about a millimetre away from the bit you don't want to lose sensitivity on. And it took me about 45 minutes to an hour to dissolve this filler. And when I watched CCTV back, the girl was screaming. How I never got a police coming through the clinic, because she was screaming. And then she sat up and she said, "Oh, is it all finished?" And I said, "Yeah, it's finished." There was blood everywhere, and she went, "Can you put it back in?" And I was flabbergasted. Put it back in. I was like, "No." She went, "If I come back tomorrow, will you put it back in?" And I was like, "No, I won't." And we were just then going on to say, I blame Instagram for that. I do. I think it's this mass following of Instagram, and people do what they want to do. Why did she want it? Oh, well, it's a big thing, Bliss. I mean, it's if you actually Google it, there are clinics all over the UK doing that. And for men, right, I'm going to be careful how we say this, and for men. So apparently
that's a thing now as well.
That's a thing now as well. We haven't done that. Your husband needs one, Joanne. Yeah. So we won't be doing that. But you know what? We're actually going to now see people have that, and you mark my words, we'll be on TikTok here. In I reckon about 2 years, saying the same thing about it's gone wrong for men. Is that something you want to
continue doing?
I won't be doing it. No, I won't be doing it for the women or the man. But there we go. So we will leave the comedy on that side. Let's go back to fillers. So what the nurse is going to do now is she's going to use a pencil and just draw on my face where you put different fillers. So let's start at the forehead. Let's assume I can't have Botox, then you'd use fine there. And what would you do? What would you do with it?
So most people would usually, if you come here, would have like a deep line here that sometimes goes across or sometimes just goes straight in the middle. And sometimes Botox can't target that because it's just way too deep. So we'll put a bit of filler in there, which will just bring that smoothing out that skin. So that's one area we can put it. Also probably very deep lines that run across the forehead we can also fill with fine filler.
And then nose?
Nose, so as Paul was saying before, so some people would have a hump for many reasons, just the anatomy of the nose. So what we could do is fill just on top of the bridge, which just would help to straighten out that nose. Also, if you want a pixie nose, so just a bit more to help lift the nose, we can place it right in the middle of that nose, 90 degrees, and that will just help pull up the nose a bit. Yeah, and help with the length and the straightening shape of the nose.
Cheek? So
cheek, how we mark cheeks is we'll go from the corner of the eye to the corner of the nose. I'd usually do this with a ruler, but and then from there we know not to go, and then we'll go from the top of the tragus, from the nose, and just draw a line. And then that's where you can see the cheekbone, and we place it straight into the cheekbone. And depending, some people do like a more aptly looking cheek, and some people don't. So it just depends on your preference where we do place the filler.
Okay. Jaw, what about this side?
Jaw, some people only like to fill this L shape. They just like that L shape look. Some people want it all across the jaw. So we'll place 3 dots, or depending on how the anatomy of the face is, and we'll just fill that jaw, which gives it a more sharp and defined look. Chin. So some people have a pebbly chin, place some in the chin, or some people want, for facial balancing reasons, want to elongate the chin, so putting some filler on the chin will help with that.
Nasal folds?
Nasal folds, so also known as laughter lines. You can place filler right here. This will help just get rid of them very deep lines. And usually it stops from the corner of the lip to the bottom of the nostril, so that's the area that would get usually filled.
And then marionette lines?
Marionette lines, so they run from the corner of the lip down to about the chin jaw area. So some people, as you age, you get deep lines down here, so that can also just help support the jaw and the cheeks, and just smoothing out them lines.
And then lips?
So lips is an interesting one. So there's so many techniques, so many ways you can do lips, but we would place deep or fine depending on your lips, around your lips, avoiding the border because that's what can cause migration.
Is that it, do you think? Anywhere else you want to put a bit of filler?
What else can we do filler? Trying to remember now.
I think that's it.
Oh, fine line.
Temple. Well done, Tony.
So the temples, some people, as you age, or it could just be your facial, the structure of your face, get hollowness in your temples that can age you actually. So putting some filler here can bring out the skin.
Yeah, you can. That muscle will definitely affect that muscle for sure. Yeah, well done, Tony. You passed the exam. When you're doing it on live, it's really hard to remember everything, isn't it?
But
exactly
there's
right.
So many places you can put filler. So.
Now, the interesting thing is that obviously we started this live talking about the three different fillers, and they can all go in different places apart from really sub-Q, isn't it? Which is obviously the one on the jaw. Yeah, that's the one, Tony. And then we can now do it with human filler as well, can't we? So do you want to talk about that quickly?
So PRP, as most of you have kind of heard of now that we've spoken about, is platelet-rich plasma. So what we do is we take your blood, we spin it on a centrifuge machine, and it separates your platelets from the rest of your blood components. And what we can also do with that is spin it extra further to change the consistency of the blood, which helps thicken the blood up, which gives you filler, your own blood filler.
And that can go everywhere here, can't it?
Anywhere on the face. Risks are very low as it is your own blood, so it's amazing. It's much more of a natural way, so if you do want to fill deep lines, even cheek filler, jaw filler, you can do with your own blood. So that's now another option out there.
Well done. So that gives you an idea of fillers. I've really enjoyed that session. I think it was really good. We've got 10 minutes just to do some tidying up, and then if you were with us yesterday, we're doing the big reveal. So we did a test yesterday, testing lemon bottle versus pine bottle, and we did it not on a piece of bacon like everyone does. We actually did it on a pork belly. So we injected this pork belly with both lemon bottle and pine bottle. While we're taking a quick break and just tidying up and charging the microphones, if you go on our timeline, you stuck a video up there last night.
Yeah, so if you want to know all about what lemon bottle and pine bottle has, what it does, there's a video on there that tells you everything about it, and it shows how it has worked on that piece of fat from the pig. So and then it's an interesting video to watch.
And then the idea is when we come back in 5 minutes, we're going to show you that pork belly 24 hours after we injected it yesterday. So I can't wait to see the results because they're going to be, I think they're going to be really interesting. And we'll go back over what pine bottle and lemon bottle was all about before we do the reveal. So we'll be back online in literally about 6 or 7 minutes. So you've got enough time just to check out our timeline and have a look at Bina's video that she put on there last night, which is the very first video you should see on our timeline. Have a look at that because that's what we did yesterday, and then come back here in 6 minutes and you'll see the reveal. So until then, we will see you. Look at my face. Don't forget to. Yes, Tony, under eyes, absolutely. We did Bina's yesterday, so that's there. Don't forget to like us. Loads of likes are coming in. Thank you so much. Follow us, and also don't forget to send us those roses. I still don't know what those roses do, but whatever the roses do. Literally 6 minutes, and we will be back. So go watch that video from Bina, and we'll be back.